628. Good Day Columbus starts now.
7:45, welcome back. A new way to look younger by actually moving around the fat in your body. You just move it from here to there. Dr. Jeffrey Donaldson is a local plastic surgeon, and Christy Alexander, his patient. And great to see you both. How are you today?
Thank you. We're great.
So, all right, Dr. Donaldson, you just performed what's called a fat transfer procedure on Christy. Tell me what that is, where did the fat come from, where'd it go?
Absolutely. Well, first of all, most people can spare some fat from somewhere. So we took fat from Christy's abdomen and placed it high up in her cheekbones and under her eyelids. She felt like she'd been getting some hollows there, some tear troughs, and wanted to fill it out. Which
happens with everybody as we age, and so this sort of plumps that area up, huh?
Exactly.
Right.
So how do you like your new look?
I love my new look.
Yeah?
It goes along with my energy level and my attitude.
Yeah, that's great. So let's talk about the before and after, because we have pictures of Christy before.
Right.
And we should tell you, this isn't a dramatic transformation. It just makes her feel and look more youthful and energized.
That's right. Now, Christy, out of fairness, also had some upper eye lifting and some face lifting, and so we use this as a combination therapy. She felt like she had these deep hollows and loss of volume, as you see in the before photo.
Yeah.
And then under the eyelids, down there in the tear troughs and in the high cheekbone areas, we really filled that out and wanted to give her a rested, restored, rejuvenated appearance.
And you really do look younger now that we see the before and afters. It's an amazing procedure. Doctor, why not just do Botox? What's the difference, and why is this better?
Well, Botox doesn't fill the areas of volume loss. As people age, we understand now that it's not just a phenomenon of sagging skin. You can't just pull it tight and hope that it looks okay.
Yeah.
We really need to fill these areas and contour them with a natural, soft look. And you can see that in those photos, that's exactly what we've done.
And so a side effect is not purple hair? You had that before?
I had that before.
Okay, good. Christy, tell me about your recovery. Not long at all to go right back to what you wanted.
One of the nice things that I like, Dr. Donaldson is not real big on a lot of prescription medicines, and that I was taking homeopathic medicines, and I also do positive thinking and visualizing, and I did my art, and of course frozen pea bags helped. And I think by the attitude and the way I was visualizing about the healing, I think that and the fact that he has a very soft touch that he used when he worked on me, so that I didn't have tremendous bruising, but it was all pretty much gone after about 13 days.
Well, doctor, this is liposuction essentially, so there are going to be some inherent risks. Talk to me about those if someone might be apprehensive.
Sure, absolutely. It's a small amount of fat. It's not like we're rebuilding or reconstructing a breast. I mean, this is small volume liposuction, so the area where the fat is taken is not really noticeable. It's small enhancements that tend to take on the blood supply of the surrounding tissues and again have a nice soft appearance. So the risks, inevitably a little bit of bruising, some swelling, but after a week or two it tends to fade out very nicely.
No real infection risk though, I think.
A small risk of infection we do cover with antibiotics just to make sure, and we watch our patients very carefully post-operatively.
We're about out of time, but about how much does this cost?
For a small area in the range of $1,500 to $2,000. For something throughout the face, more than $3,000 or $4,000.
So you happy with this? Would you do it again?
Oh, absolutely.
Yeah? What do people say when they see you? Have you told people?
I haven't. No, I haven't
you're
told
telling
people.
them now.
Here it is. No secret anymore. No, people just, they look at me. You can tell they notice a difference, but I haven't just outright said, oh, by the way.
Well, that's what you want. You just want them to think.
I want them to think, wow, hey, this has been a great summer break.
She's relaxed and just getting better with age.
Relaxed, that's
like a fine wine, that Christy.
Absolutely.
All right, listen, it's called, what is it called if you call and say, I want this? Fat transfer procedure?
Yes, fat transfer, fat grafting.
Dr. Jeffrey Donaldson and Christy Alexander, thanks so much for coming on.
Thank you.
We appreciate it. Lisa, she looks great.
Oh, she really does. Fantastic. After this baby, sign me up. Seriously.